Hello friends, welcome back. Knee pain is one of the most commonly seen clinical cases today. In today's video, we'll discuss about Azhal Keelvayu, which is otherwise called osteoarthritis in modern science. Before going to what happens in Azhal Keelvayu, let's understand how our normal knee looks like. So a knee joint is made of two bones, our thigh bone and shin bone called tibia. So the two bones come together somewhat like this and forms the knee joint. In the front of the thigh bone there is a small circular bone called patella which forms the joint with the thigh bone. There are also other structures like four ligaments, and also at the end of the two bones there is a cushioned rubbery substance called articular cartilage which helps the bone from getting damaged. It protects the bone and also helps in the movement. Surrounding the bone there is a cavity called synovial cavity in which a fluid called synovial fluid is present that helps to lubricate and prevents the articular cartilage from getting damaged. So this is how a normal knee joint looks like. Now what happens in Azhal Keelvayu? According to Siddha, due to some reasons or factors, the Azhal or the pitta or the heat in the body gets deranged, due to which also affects our knee and other joints. So in the knee what happens is the synovial fluid starts drying up. That leads to the friction between the two articular cartilage, and slowly the articular cartilage starts rubbing against each other. At this point the patient may experience pain, stiffness, and also crepitus, like the crackling sound that comes with flexion and extension and during the movements. Also the patient complains of lock knee when the patient gets up from the seat or when he wakes up. For some time the stiffness is present and also the knee gets locked. So these are the common symptoms which a patient faces. During the examination, the physician finds there is tenderness around the joint, like when the physician examines, there is pain and tenderness around the joint. Also the x-ray reveals that the normal joint space between the two bones is reduced, and there are osteophytic changes like bony growths, and due to the rubbing of two bones, when the articular cartilage completely deteriorates and depletes, the two bones starts rubbing against each other and there is immense pain, and also there are bony growths on the sides of the bones which can be seen in the x-ray. So this is what happens in Azhal Keelvayu. Now who all are prone to this problem? Females above 50 years or nearing menopause, because at that time the female hormones which gets depleted, and also the body has immense heat that leads to Azhal Keelvayu. Also people who are overweight, because knee is one of the most important weight bearing joints, and if a person is overweight, that due to wrong eating habits or many metabolic problems they have, that also leads to Azhal Keelvayu. Though we say that it is an older age problem, but today even younger people have this because of wrong eating habits and lifestyle problems. Also, if a person has history of previous knee injury, then also that person may be prone to this problem. Now there are some things which should not be done if one is suffering from knee pain. The first thing is avoid sitting for a long time. Sitting for a long time can build up fluid in the knee, which can again increase pain and stiffness in the knee joint. Another common mistake which one makes is applying random balms and oils and ointments on the knee joint. Actually, rubbing of such ointments and balms increases the heat around the knee joint. It also increases the pain and stiffness. Temporary relief may be there, but in long run it may do more harm to the knee joint. Then direct application of heat to the knee joint should be avoided. If a person has knee pain, if heat application is done or heat is applied on the knee, the pain and stiffness may again increase. Many times the doctor tells the patient, like if they have this knee pain, they should reduce their weight if they are overweight. Increased weight should not be ignored, but going for a crash diet is not advised. Always plan your weight loss program with your doctor. Doctors may actually advise kneecap for patients, which is put around the knee. It's an elastic band It actually protects the knee from if you're if during movements or during activities, but some people use it throughout the day. Actually doing this may again increase pain and stiffness. So if it is advised to you, only use it when you're climbing stairs or long standing time, or when you're engaged in any like traveling or any other activities. Otherwise it's better to avoid. Now, how we approach treatment in Siddha in Azhal Keelvayu. The primary cause of this problem is increased Azhal. So first what primarily we do is reducing like medicines which is given to reduce the Azhal. For this, mild purgation which will induce soft stools for 2 to 3 times is given, and then the body's heat is brought down. If there is an increase of vata in the nadi, for that also medicine is given. Then there are medicines which are given for inflammation, stiffness, pain, and also to protect degeneration of the bone. External treatments, vigorous massage and kiri and all are contraindicated in this case, but there are external treatments, marma, and there are oil therapies. Also some oils like it's cold potency oils like ulund, masha oil, and there are also pooch external applications which are recommended to bandage the knee. It helps the knee, it protects the knee, and also it prevents further degeneration of bones. People with knee pain are also recommended low impact exercises like cycling, walking, yoga, and yoga stretches, aerobics, instead of high impact exercises like and other strenuous weightlifting exercises. Always go for low impact exercises. Food is one of the major part which comes along with the treatment. So foods like any food like underground roots like tapioca, red meat, processed foods, sugars, and also foods which induces indigestion, those foods are supposed to be avoided. So this is way how Siddha manages Azhal Keelvayu. If you have any doubts regarding this, you can mail us at info@siddham.in. Also, if you like this video, don't forget to hit the like button and subscribe our YouTube channel. Thank you for watching.